Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Carol Collings. She's a board-certified radiologist and she's currently the Director of Breast Imaging at Radiology Associates of Macon and also at the Breast Center at Atrium Health Navicent. And today we're going to talk about some new techniques in breast imaging. Dr. Collings, thanks so much for joining me.
Thank you for having me.
Would you let our audience know a little bit about this new technique, molecular breast imaging?
Sure. So molecular breast imaging is new technology that my practice, Radiology Associates, has brought to the Middle Georgia area. And this is a fabulous thing for women, especially with dense breasts, because it's very sensitive, extremely sensitive for picking up breast cancer.
When we talk about detecting breast cancer, what have been the more traditional methods that generally people would know about?
So the main thing that we ask everyone to get every year is a mammogram. And that is the best overall screening procedure we have for detecting breast cancer. But there are some new things that are also helpful and important, especially for people with dense breast tissue. If you have dense breast tissue, it can hide a cancer on mammogram. So another study that we now have is this molecular breast imaging. We call it MBI for short. And it is not a structural image. It doesn't take a picture of the breast the way a mammogram does. It actually looks at the function of the breast. So it is going to show things differently. It's not going to have the problem that mammograms have with breast density. Breast density does not affect it at all. So you can have a dense breast and you can easily find even a small breast tumor, 3 to 5 millimeters, with this molecular breast imaging. It is going to be a game changer for women here with dense breasts.
Do you think that women know usually if they have dense breast tissue? Is this something that they know physiologically, or they might have been told they have that?
Well, in the past, women would have had no idea if they had dense breast tissue or not. And now, though, we are actually informing people if they have it. It is very important because dense breast tissue actually increases the risk of breast cancer. So someone with dense breast has a 3-time greater chance of getting breast cancer than someone with fatty breast tissue. So there's a new breast density law that was passed in February of 2019. And that law states that we must inform patients if they have dense breast tissue and let them know that this can increase the risk of breast cancer and that they should consider additional screening tests. So people with dense breast tissue will now be receiving a letter in the mail from the radiologist informing them that they have dense breast tissue and that they should consider other tests.
So if I receive that letter, or even when they're reading the mammogram results, I'm guessing then I need to come back for another, once I've been advised of that, I need to come back for the MBI. Can you tell us how the MBI is done?
Right. So molecular breast imaging is a nuclear medicine study. It's not a mammogram study. It does not use x-rays. It uses a radio tracer. So when a patient comes for the molecular breast imaging, they're going to feel initially like they're just having another mammogram. But it's actually very different. So initially they will be injected with a radio tracer in the vein in the arm, very similar tracer to what's used for the heart scan, the very common heart scan. And so then immediately after they're injected, they're going to be positioned in a seated position in the molecular breast imaging machine. So it's comfortable. They'll be able to watch TV. It takes about 30 to 35 minutes. And the same images that are taken, the same projections that are taken for the mammogram are going to be taken for the molecular breast imaging. So there'll be 2 views of each breast, and we're going to read those in conjunction with the mammogram. So you have to have a mammogram within a year of your molecular breast imaging. And so the images are taken of each breast, and that's pretty much it.
If I come in for the mammogram and I get the letter about having dense breast tissue, am I getting the MBI on one or the other? You mentioned having views on both breasts. Is that because of the density of the breast? It's not because anything that was found on the mammogram. It's just I need the additional test.
No, the law doesn't say you have to have MBI. It says you should consider additional screening modalities if you have dense breast tissue. Those could be MRI, they could be ultrasound, they could be molecular breast imaging. I would say that molecular breast imaging and MRI have about equal sensitivity for detecting cancer. They're in the high 90 percentile, whereas ultrasound not so much. So MBI is about twice as sensitive than ultrasound for detecting additional breast cancer. So some people are using ultrasound, some people are using MRI. MRI is a lot more involved exam. It takes a lot longer to do than the MBI. It's much more expensive. Some people can't have it because they have allergies to contrast, or they have renal failure, or they have pacemakers, they can't have it. So there's a very big role for MRI. But all I'm saying is that MBI is another modality that can play in a role for this additional testing.
So as a radiologist, do you have to have additional specialty skills or training in order to read the MBI, or are you already through your board certification qualified to read tracer?
Yes, in our diagnostic radiology training, we are trained to read nuclear medicine images. So the principles are all very much the same, but really you would want a breast imager to be reading this particular nuclear medicine type image because it has to be correlated with the mammogram. So in our practice, we have eight radiologists who are primary mammographers that would be reading these images. It would not be everybody in the practice. So especially trained to evaluate the mammogram. And sometimes you're coordinating a mammogram, an MRI, and an ultrasound all with the breast images. It's not just for dense breast tissue. We also will use it for patients that have an inconclusive mammogram. So if they have a palpable lump and they go for a mammogram and ultrasound and nothing is found, but they still feel it, their doctor feels it, we're worried about it, we could do the MBI and may find a cancer that just isn't picked up on the mammogram or the ultrasound. And I've actually seen that many times. So it's very impressive. We had one patient come in, she had a lump and we couldn't find anything on the mammogram or the ultrasound. She had the molecular breast imaging study and she had a high-grade breast cancer, triple negative breast cancer, which is, pretty much a bad actor. So might have been another year before we found it.
So if a patient has a mammogram and receives this letter and decides that MBI is what they would like to, or they'd like to discuss it, what's the best way for them to get more information about the procedure? Right.
So if they receive the letter that they have dense breast tissue and they should consider another test, if they know about MBI, which I hope they will, we're trying to get the word out there, they can call radiology associates to schedule it, but first of all, they can always talk to their doctor about it. So I do have an example of a case which I think would just be helpful to show. It is a example of a patient with very dense breast tissue. So you can see on the side over here, there is a mammogram, and the white that you see in the picture is the dense breast tissue. And cancers look white on mammograms as well. So if you had a cancer sitting in that white breast tissue, it would be like a needle in a haystack. It would be very difficult to see it. On the other side over here, we have our molecular breast imaging image, and you can see that the density doesn't cause a problem. The cancer is in the circle here. It's very apparent. The rest of the breast tissue looks completely clear. It's not difficult to see it. So,
right. Yeah, exactly. And to your point about the image that you're sharing, this is not necessarily the size, but it is the reaction of the tracer that you're actually
seeing. It can be, sometimes we see much smaller abnormalities, and if you have a really large mass, it's going to show a large amount of uptake, but a small mass might look bigger on the MBI image than it actually is, just because it may be intensely taking up the tracer, which just makes it sort of bloom. So.
Yeah, well, thank you for showing us that. I think that does definitely demonstrate, the visibility from the two procedures.
It's pretty impressive.
Yeah, thank you. Yeah. Well, thank you for telling us so much about it, and I hope that a lot of women will see this and eventually pursue getting additional diagnostics.
I hope so.
Yeah. Well, thank you.
Thank you.
And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Collings and her practice, please visit us at atriumhealthnavicent.org.